Good afternoon. Welcome back. And if you're just joining us for the afternoon, welcome to the Pennsylvania Community Alliance Summit. My name is Dana Thompson. I'm a project officer for the Pennsylvania Developmental Disabilities Council. We're glad you could join us today. If you have any comments, thoughts, or questions throughout the session, please feel free to type them in the chat box or the Q&A box. And now, without further ado, I'd like to turn the session over to Ms. Tiffany Levette from Her Power Incorporated. And Tiffany will tell us more about her organization. Thank you.
Thank you very much, Dana. It's a pleasure to be here. I am glad to contribute any of my experience or expertise, and I'm also looking forward to making connections with some of you across the Commonwealth. I've seen some amazing people and heard about some amazing work that you all are doing. Her Power Incorporated is a women's empowerment organization that grew into ABC 24-hour child care because we wanted to meet the demand and the need for child care in our area. So moving forward to pre-pandemic, we had a facility, 156 enrolled children. Things were going pretty well, 23 staff. Our business was growing. We implemented a few things in our program because we wanted to help meet the needs and address the needs of our families in the area community. So our goal is to impact the lives of families one child at a time. We wanted to find out what were the barriers between parents at home in obtaining and gaining adequate employment. What was the gap and what were some of the barriers? So one of the largest barriers that we saw was a transportation barrier, access to adequate childcare, access to quality childcare, and access to work. How were our parents going to get back and forth? Well, our facility, we decided to offer transportation as one of the services to our program. So we began transporting parents and children to the facility, and we would also take the parent to work and repeat the same cycle at the end of that parent's shift. A great program. Also transporting children to other pre-K programs and to school and pick up from school. We were doing it all, transporting families across our community. Another thing that was a problem and a deficit was the food insecurity had become a serious issue in our area, something that I have become more aware of as a provider in the community, just from meeting the families and assessing the needs. And where in the world does this come from? Let me tell you a little bit. I have been a licensed social worker for 10 years. I practiced in the field for 21 years. So this is from this background and combining the two, combining the social work as well as my child care and entrepreneurship abilities. Here, this is how we are getting all these services and trying to address and meet these needs in the community. So moving forward, we have a pantry in our facility to help meet the insecurity issues and food deficient issues that our staff and parents were experiencing with themselves as well as their families. So we started a pantry, and so we would send parents home with these baskets. We made some community partnerships and collaborations, and so things were going well with that. Coming to the pandemic, it was something that really jolted all of us. It was completely unexpected. And we closed our facility for one day, and we received a waiver from the governor to open back up in order to provide that child care for essential workers. In order for our nurses, our doctors, our plastic workers, our bus drivers, our waste management, in order for all of them and more to make it to work, they needed to have somewhere to take their children. So we remain open. It was a huge adjustment. Lots of things that we had to put in place to ensure, number one, that our children and our staff, as well as parents, were safe coming into and leaving from the facility. What did that look like for us And I say us, and I'm also speaking to what I know other providers have gone through and adjustments that they have had to make. We, of course, began to take temperatures, documenting temperatures, which was something that DHS put in as a requirement, which absolutely we agree with those things, those safety measures. Also with, of course, hand washing is something that we've always done. We increased it a bit. Also, in each class, we have our mobile hand washing, our portable sinks that we use. And as a result of the pandemic, we decided to change those from portable to stationary. So we had some plumbing put into the facility. We also had to invest a lot in PPE equipment, right? We have all experienced this. We have all had to put some funds in PPE equipment. Not only that, we had to increase pay and wages in order to help to meet the needs of our staff. We saw a decrease in staff because we also had staff with children who were not comfortable returning to work, or their child wasn't in school and they didn't necessarily have their child enrolled in daycare. So we went from, at our facility, having 23 staff way down to about 15. It also is seeing a decrease in the number of children that were coming to care. So at one point we had 156 enrolled. We went down by 100 children during the pandemic, 100. And literally now our numbers are slowly increasing. So how were we able to function with only having 56 enrolled children versus 156? What did that look like for us? Well, it looked like grant funding. It looked like opportunity. There was lots of funds, millions of funds coming into the Commonwealth of Pennsylvania, millions of funds allocated that have gone through Octal, that came through our ELRCs, that literally came into the hands of providers. This helped many of us to remain open. It didn't happen this way for all of the providers. During this time, there has been, from the beginning of the pandemic up until the latest statistics I've seen, April of this year, there has been a decrease of about 500 licensed child care providers across the Commonwealth. And so what did this mean and what did it look like? It created more of a child care desert, more so in central Pennsylvania. This is where we saw more of the critical child care deserts. In the surrounding areas, more spread out across the Commonwealth, was more child care facilities that were experiencing in the areas moderate daycare and child care deserts in some of the surrounding areas from central PA. So it has been a really, really interesting shift. And there were some things that we definitely had to address and meet the needs of our community at that time. So what did that look like? And there are five things that I like to discuss with you today. And one of those is food insecurity. 2, access to funding. 3, building safety and upgrades, as well as employee retention and what changed for us. So let's really dive in and talk about those 5 different items that I mentioned just now. So the food insecurity issue, as mentioned before, we have already had a pantry in our facility to help to address the needs of our children and families. So that was a way that we chose to be an impact and an influence and relevant in our community. This was our contribution and our way of giving back. So pandemic time, it was difficult. There was the unknown. There were issues with parents having access to baby formula. Stores were literally running out. Like the transition and the pandemonium during that time, it was really scary. And in order to support our families and support our community, we had to figure something out. So we decided to put $5,000 of our own money into meeting those needs. And I mean immediately, because we had senior citizens that couldn't get to the stores. We had parents with children with disabilities, and we had families in the community that did not have the same access did not have the same resources. And this is, I mean, this really, really, really touched my heart deep, because there was a deficit in people that I knew and lived next to and served and who supported small businesses were suffering. And it's important to take a minute to think about this, because the things that we never thought could happen actually happened to us. Very interesting. So with dealing with the food insecurity issue with children, we knew at daycare that our children would eat on a schedule every 2 hours, with the exception of nap time. Every 2 hours. And my question was, what was that going to look like now that our children were home? Now that the majority of them, their parents were not essential workers, or were not considered to be by definition at that time, how were our kids going to eat? And so that's when we really pushed in. It was really neat because we pulled the community together. We got parents together, volunteers, staff together, and we literally took our school bus and went grocery shopping. Really neat time where people who you wouldn't even think or know that would give and pour back into the community in this way. It was amazing. It was amazing to see all the love and concern for mankind during this time. So we did the grocery shopping thing and brought it back to the facility. And literally our entire gross motor area and computer lab was like a huge food bank, okay? We had food and supplies spread all around the facility, and everybody worked together in a line, and literally we packed boxes. Who was this for? This was for our families and our children and senior citizens in the community. We packed PPE boxes for them. We had masks and cleaning supplies, and we had food items. I mean, things that will help to sustain them until we knew where the next was coming from. We also sent food boxes to families. Now, how was our families, which 100% of them received CCW funding? We live in one of the most impoverished, and I say we live, the child care facility, most impoverished areas in our community, our zip code down there. So it's the downtown area. And the majority of our consumers were from low income houses. As a matter of fact, all of them, we have 100% CCW parents. So most of them didn't have transportation. A lot of people in the community who we encountered did not have transportation or access like the majority of our members in the community did. So what were we going to do? We had to find a solution. And we got in that bus, we got in vans, and we delivered the food door to door to our families and senior citizens. This was on a small level. We were able to feed about 300 families with our $5,000 investment. So moving forward, we partnered with the Erie Public School System here, and we were able to get food items for our families. So guess what? That helped us to carry over after our 5,000 went out. We were able to continue doing the work. We then partnered with 3 community centers and wrote a grant together. We wrote and was approved for a $50,000 grant, which was amazing. And from that, we were able to feed more than 10,000 senior citizens. Oh, it was amazing. It was amazing. Also from that, we purchased more formula, diapers, baby wipes. Not only did we provide these items to the ABC families at our daycare, but we opened it up to the entire community because we knew that children and families were suffering. Senior citizens were suffering at that moment. We received calls even from 30 and 45 minutes out. We received calls from as far as California who had family members in our area that needed help with baby formula. And so the food insecurity issue was some pretty neat reports out here that I found on our Pennsylvania site. So if the food insecurity thing is something that you're more interested in, please go. There's some really neat studies that have taken place, and I really enjoy reading all of that stuff. The other many facilities closed during that time, were not able to sustain. And we went from across the Commonwealth having approximately 7,000 licensed facilities open across the Commonwealth to approximately 6,500. So we had a decrease of 500 licensed facilities who were either closed or temporarily closed, permanently closed or temporarily closed. And so there were 260 to be exact, that closed permanently. And the other 240 were those who had to close temporarily, and some of them may open up this September for when the kids return to school to be available for that after school care. These have been some significant transitions. And so what happened is at that time, during the beginning of the pandemic, Octal performed a study. It was a collaboration. They had actually Penn State work on the study, but Octal produced a study that was really, really beneficial. It helped them to understand what childcare providers needed. Oh, and just so you're aware, I'm not affiliated with Octal in this way, don't represent the company at all. However, I am a licensed child care provider. And this is the Office of Child Development and Early Learning. Office of Child Development and Early Learning. So this is Octal. And so they have been such an amazing support to child care providers. But the study that they did, it showed where the deficits were. It showed the facilities who were at risk of closing at that time. And what they found out from the study, that there was an additional 1,000 licensed child care facilities across the Commonwealth that were at risk of closing. We were one of those facilities. We were at risk of closing, along with 999 other child care facilities. So they made a decision to pour funds into child care facilities. At that time, it was 116 million that was released at that time. So there has been more pockets of funding poured in. We have been a beneficiary of 3 rounds of funding. And how do we make sure that this spread to other providers, and how do we ensure that everyone was able to apply and understood how to apply? And so this brought in another portion for me, which is the child care consulting. And I work to help individuals, organizations, faith-based organizations, or companies to grow or develop child care facilities. And so what happened was I was able to pull together a cohort of child care providers, mostly minority women in this group, and share information with them on what funds were available, on how to apply for the funds, what documentation was required during the funds, and what was required after. And so I was really glad to be able to, help some providers to apply for these grants, because this is a service that I also offer with the consulting. We do grant writing. So what better organization or what better group of people to help at that time the child care providers? So it was amazing. And this is something that we still are doing now, because funds have run low with child care facilities, and many of us are at risk of closing still. So what's happening as a result? One, Octal is performing part 2 of the study right now in that collaboration with Penn State collecting data. We were one of those sites who were selected to have to participate in that research. We were really glad to get feedback and share information on what others were experiencing in my area. And as a result of the studies that Octal has done, they poured funds into facilities. They knew where to do it, how to do it. It was really impactful and helpful, and we were able to continue to employ staff. So that was something major. And with those funds, I know we had to increase pay, increase incentive. In addition, we also had the $600 incentive for those staff that qualify for that. You had to, work a certain amount of hours and make a certain wage and that kind of thing. So it was really good, because I was able to give that bonus to all of my staff. So what what's happening now? So after the study, Ogdale will know more about what's needed moving forward, because what we've seen is that the pandemic has had long-lasting effects and will have a long-lasting impact. And for us, what that means is these months and possibly years, the finances in childcare, though money has been pouring in the cycle, it has been helpful, it has been difficult sometimes not to know where the next source of funding is coming from. So that's another thing. So I also have been researching grants and to find for child care facilities as well as other businesses, which has been pretty cool and interesting, learning a lot in that way. So I'm looking forward to the next study being completed so we can kind of see what's going to come of it. So that was one of the things that I wanted to talk to you about, is the number of facilities that closed as a result, and that access to funding and the risk of going out of business. And why did it happen and what did that look like? So many would think that the need for care, the demand had increased, but it didn't. And the reason why is because we had a lower number of parents who were going to work at that time. Some due to fear, some due to other personal reasons or decisions or financial decisions or decisions about children, or just being uncomfortable with the idea of sending their child into a facility with other children and the risks that were involved. I mean, this was a huge, like, parents had to make so many decisions. Child care facilities had to make so many decisions. And so did a lot of you who are listening to me right now. I get and I know what you've been through. I've been there. Many of us have been there. And this child in the area of child care, our kids ultimately, to me, are the ones who have been impacted the most with the changes that have occurred. So the access to funding and that risk of closing. So the next thing was the building safety with the changes that we had to make. Fortunately, we had financial support with the grants that we were able to apply for. We also had support from our county, Erie County. And so our county executive, Kathy Dahlkemper, and the powers that be, they had funding available for child care facilities, and we were so excited and grateful. We applied for that funding as well, and were granted that. It helped us to meet the needs of payroll. What in the world is happening with the battle that it seems that we were experiencing with that when we talk about payroll? And that is what I'm going to go into next. So the next one, the employee retention. How was the employer going to retain employees? This right here was pretty interesting, and it was a challenge. And what did that look like? Of course, as mentioned, we had many staff who did not return for multiple reasons. And one of the biggest challenges is it felt like we were in competition with the compensation. And many childcare providers, one, were not able to pay as much as some other providers, maybe in the health and medical field. We can't pay as much, so it's already a struggle in childcare land. But some of the answers and responses that we would get from employees and from finding information from employers is that it was not beneficial for the worker to return to work. And so what did that mean? Well, if I return to work full time, I won't qualify for some of these benefits that can help to sustain my family. And this right here, this was a significant challenge because it took some conversations, it took some convincing, it took financial planning with my team. It took about their personal finances. It took some trust for them to know that they still had a job to come to, though we were still in the pandemic. It also took an increase of pay. We had to have some incentives. So that funding that I was talking about coming in from the the county, from the state. I'm telling you, it helped us to meet the needs of payroll. I went from 23 staff down to 14 staff. And with that, but it seemed like my payroll had increased. It increased significantly because then I ran into the situation where there was constantly overtime because a small amount of staff that I had. So now pretty much what's happening, and then we had to have smaller classes for social distancing. That was that was challenging. We were having no less than 60 hours of overtime per week. And with a company as small as myself and other providers, that was a challenge. But fortunately, we had that support. And the other is, so what changed for us? And what did it look like? It looked like increased partnerships with stakeholders in the community. It looked like more of us working together. It looked like collaborating with the public school system and understanding like what their next steps were, what they were planning to do. So we knew how to work together as a team in the area of child care, early learning, early education. Like we had conference calls, we had meetings. I mean, we pulled together to meet the needs of the children and the families in our community. And let me see on the side there. Okay. So it was really interesting because things changed. When at one point we were fully operational, we had transportation going all day. Transportation was pretty full. We actually hired a driver to handle transportation alone. That is not a need right now. It's not a need, and there's not a demand for it right now because we don't have as many parents that have returned to work. Not as many parents have returned to work. And the demographic of parents who are utilizing child care services seems to be changing. Where at one point I had 100% CCW, that is shifting a bit, where I have about 20% private pay and 80% CCW funds. And so what's interesting in the same is changing with the employees that we have been able to retain, and the employees that we've been able to recruit. So it's been a very interesting journey. And now one thing that's happening is there's a lot of funds that have been put into education. So during this time, we really focused on staff training and education. Many staff enrolled and completed the CPA program, and some have enrolled into the associates, and I also have a staff who is now enrolled in the bachelor's degree program. So though this has been very challenging, there have been some positive outcomes that came as a result of the pandemic, where I'm seeing an increased number of staff returning to gain more education, get more insight, grow in the career lattice in early childhood. And that I'm excited about. So though financially it was a challenge, having those low numbers for a period of time really helped us to pour into staff professional development. So do we have any questions right now in the chat box? Okay.
None that I see, Tiffany.
Thank you very much. And so I'll be coming to a close pretty soon, but I just wanted to remind, if I know all of us have child care facilities maybe on each block in some areas, but if you know of a child care facility that is open, don't hesitate to volunteer. Contact that director or owner. Go in there and say that you want to, volunteer to read a story to the kids. Like, let's keep this relationship and let's keep these collaborations and partnerships building and growing with our smaller communities and even across the Commonwealth. There are a few people who I've seen, presenters about in the early learning lane, but I'm like, you know what, they'd be a great person to collab with, because some programs that you have over on the East Coast and versus North South or that we have on the West Coast, we can figure out a way to kind of swap information to know more how we can serve one another. So I really appreciate you, and I appreciate the time for being able to share with you from a child care perspective on what it is we experienced through the pandemic. Please don't forget to volunteer. Even if you have an extra basket of fruit, don't hesitate to give and pour into your local child care facilities. Thank you all, and you have an amazing day.
Thank you, Tiffany. That is fantastic advice. I love that idea. I hadn't thought about it. So thank you everyone for attending. We are going to take a break now, allow you to take a break as well. Our next session on track 1 will be Shivani's Law with Julie Chivanes. And on track 2, you could hear from the Pennsylvania Office of Victim Advocate. Those will start at 1:30. Thank you.